Hello, my name is Dr. Chris Kolker, and this is ChristianWebMD. The topic at hand is acne and its treatments. Usually by the time a teenager or young adult comes to my office, they've usually tried some of the more basic things for acne. And actually, acne can be very psychologically debilitating. They look different than everybody else. They look flawed, and oftentimes they feel flawed, and that's a tragedy. So as a physician, I really try very hard to do the best I can to deal with their acne. For mild to moderate acne, usually we start with benzyl peroxide. Now that's the same thing in Clearasil, and oftentimes patients will say, I've already tried that. If they haven't though, 5 to 10%. For mild cases, maybe all that's needed. Topical antibiotics may have to be used next, whether it's clindamycin or erythromycin. Those seem to be the most effective and are often used next. Occasionally tetracycline or Azelaic acid is used as well, but those are second-line treatments. There's another type of medicine called topical retinoids that can be used if those are not sufficient. These help the inflammatory lesions by chemically taking off the top layer of dirt and of dead skin. These are tretinoin, adapalene, and tazarotene. Adapalene is probably the best tolerated, it's the one I use the most. However, they can cause the skin to have this kind of reddish, sunburn-like appearance because they're more powerful. At times, no cream or gel will seem to help, and then sometimes we have to prescribe oral antibiotics. That means antibiotics by mouth. They work pretty slow, usually over 2 to 3 months, but there's something that we can go to. That would include doxycycline, tetracycline, erythromycin, or minocycline. They usually are used with one or more of the skin creams as well. For females, oral contraceptives can be used for acne control. I found they work moderately well, but they're not miracle pills either. Sometimes they're used with something called spironolactone that can help even further. Finally, if nothing works, Accutane can be used. It's an extremely dangerous medication and should be used as a last resort. Only qualified dermatologists can prescribe it. I certainly cannot. It will cause birth defects if someone's pregnant when they are taking this medication, so it must be used, again, as a last resort. However, it is very effective for the treatment of severe acne, but you'll have to talk to a dermatologist about that. Remember, this video is for educational use only and is not intended to diagnose or treat any disease, including acne. If you have other questions about acne, please contact your physician or dermatologist. Thank you for watching ChristianWebMD.